Through education, we empower minds to heal, hearts to care, and hands to save lives. Today, we have all gathered here to remember and honor one such medical educator par excellence who has inspired generations of doctors and other healthcare professionals. We welcome everyone present here, as well as the ones joining us online for the MAHE Dr A Krishna Rao Memorial Oration. Today is an auspicious day, as it also marks the 100th birth anniversary of Dr A Krishna Rao.
Dr. A. Krishna Rao sir was one of the first faculties of Kasturba Medical College, Manipal, laying the strong foundation for our esteemed institute. He served as the Dean of Kasturba Medical College for 22 eventful years, which helped KMC scale greater heights. Even after his retirement, he continued to passionately teach and help to build the medical education department. The MAHE Dr. A. Krishna Rao Memorial Oration is organized every year by Department of Medical Education, Kasturba Medical College, Manipal, as a tribute to one of the finest teachers in KMC Manipal, Dr. A. Krishna Rao. And we, Dr. Simit Verma and Dr. Prithvishri Ravindra, are privileged to host this special occasion.
This year, the MAHE Dr. A. Krishna Rao Memorial Oration will be rendered by an eminent medical educationist, Dr. Avinash Nivritti Supe. Dr. Avinash is a consultant GI surgeon, Zen Hospital, Mumbai, Director, Clinical Governance, Hinduja Hospital, Mumbai, Emeritus Professor of Surgical Gastroenterology and Medical Education, Sage GS Medical College, Mumbai. Dear Sir, we invite you to deliver the oration lecture, Artificial Intelligence in Medicine. Over to you, sir.
Can we have slides here also? Sure. Can somebody just make slides here? I'll just try it again. Just give me a minute. It's okay. It's not coming there. It's okay. Thank you so much. I think respected all seniors, dignitaries, and all faculty members and students. It's a really honor for me to be here. I always feel that MAHE has been one of the top institutions in India, and giving a prestigious oration like this has been a great honor in my career. I would really like to thank Dr. Ramnarayan, who has not been my guru. He has taught us during our early days about medical education. He took a lot of workshops for us. Dr. Kirtana, Kasturba Medical College team. I have no conflict of interest, but I need to thank some of my friends who have helped me to do this. Dr. A. Krishna Rao has been a doyen in the field of medical education who introduced this in this MAHE. I'm sure he was a pioneer, great writer, was known for his simplicity, commitment, and courteous nature. He contributed immensely to medical education field by implementing news of teaching, and he was the one who showed the path to the medical education in this particular institution. So I would like to pay my respect, especially on his 100th kind of an anniversary, and I feel, his centenary, and I feel this is something which is honor for me. Steve Jobs' market research and iPhone. Our task is to read things that are not yet on the page. That's what Steve Jobs said. People don't know what they want until you show it to them. That's why I never rely on marketing research. Our task is to read things that are not yet on the page. This is what he said when he introduced iPhone in 2007. And iPhone 2007 was a life-changing event for every one of us, because today we use all smartphones. If smartphones were not there, the kind of mobiles we are using and now we are using have been totally different. So Steve Jobs showed us the way. So what will shape the clinical practice in future? If you really look at it, there are 4 things. disinformation, pseudoscience, technology, and changing doctor-patient relationship. So today I'm going to concentrate mainly on the technology aspect. I'm sure we can talk on others. So we have changed a lot. When I joined medicine in 1974 as an undergraduate student, there was no ultrasound, there was no CT scan, there was no laparoscopic surgery, there was no modular OT, robots, navigation. But patients used to trust their doctors. We saw a great technological revolution, more technology, more control, technique-oriented surgery. Technology is growing in medicine. Practically look at the number of variables and the new techs which are coming up. A lot of apps, AI coming up. Today I have OTs like this which are studied with technology. Today we have a lot of technology. We know much better about the patient and his disease, but patients have limited trust on us. So in this whole kind of a scenario, the new thing has come, and that is artificial intelligence. Artificial intelligence, this is a word which is liked by somebody. Somebody feels, oh, this is not for me. Some people say, oh, I'm not really going to use it. So I want to really take you to this journey of artificial intelligence and what is coming in the future and how we should look at it as a clinician. Artificial intelligence has already entered our life, without knowing or without realizing. The first thing came artificial intelligence was Google Map. You change the route and they will recalculate. When the Google Map came, everybody was not sure about it. But as the data went into Google Map, today Google Map is 98-99% right, except for the last mile connectivity if you are going in a jungle or a resort. That means the data has changed the way Google Maps do it. We see movies like this, Bahubali and Bullfight. We know this is all VFX. Nobody has fought with a bull. This is all nothing but AI, and no animals are harmed. Look at Google Translate 2006. You put English and you get Kannada within a minute. Now, how does this do it? Maybe it still needs refinement, but artificial intelligence has come in our life. Look at the number of publications in last 5 years. 181,704 publications in last year, and every day we are adding multiple publications. Why do you think world is talking about AI in medicine? Look at Frontiers of Surgery. The publications in last 5 years has gone up. That means the people have started now interest in their surgery. So let's look back and see the history of AI. AI came quite a bit early in, say, 1950. Then came machine learning, and then came deep learning. Till the time it was AI, it was just noted. When the deep learning came, the real usefulness of AI came, and that has happened in last 10 years or 5 years. So what really happened? The whole concept of hidden layers, the neural networks, machine learning, and the output which has really come, it really came. So let's first ask the question, how does this work? Let me go to a very basic person who doesn't really understand what is AI. So the AI works on two basic principles, data analysis and image analysis. Data analytics to synthetics to decision support. Basically, you do data crunching, which gives you some kind of a wisdom, and then it gives you some kind of a pathway to make a decision. Why this is necessary? Because the data doubling time and the knowledge explosion. In 1950, it took 50 years for the knowledge to double. Today, it is 73 days when the knowledge gets doubled. Too much of knowledge, plenty of knowledge. How do we really adopt to this knowledge? Every day so much of material is coming, I am not able to cope up with this. So I need some kind of tools which will make my life easy and help me to make decision making. So many predatory journals are coming. So many articles, they come every year. We really don't know whether you should read them scientifically with pseudoscience. So with this data time becoming 73 days, all that information which is really put So AI works by, it gets the learning patterns. It looks at the patterns, it looks at the machine learning. It makes predictions, neural networks, and it gives you expert system by data processing. So in beginning, it will learn patterns, make predictions, and it will perform the tasks. For example, this was a paper from Surgery 2020. I'm talking about all top journals giving you all this. It talks about putting all aggregate demographics, everything, comorbidities, surgery type. It will generate the population-based recommendations. It will do decision analysis, and it will identify the personalized patient-centered decision making. And it will give you, identifies what is the best action for this. It will suggest you. Probably over a period of time, that suggestions are going to be more authentic. Same thing, the traditional prediction of model, a patient with predicting appendicitis. If you use AI, the accuracy goes from 88% to 94%, again Surgery 2020. Second way the artificial intelligence works is what is called as an image analysis, very simple to understand. So let's look at, you have a cat and you have a dog, and you break it into multiple small images. And you give all these images to a computer and train the computer what is called as a machine learning. What computer will see, it will do image classification. More and more images you put, it will have a better way of identifying which is cat and which is dog. I'm giving you a very simple example. So it will give you all these kinds of outputs to make you what is the diagnosis. Same thing, if you give him a picture, it will form multiple layers, and then it will give convoluted to give you a machine learning. So image sampling, dimensionality reduction, convolutional neural networks, and it will classify and it will identify. How does it help in clinical setup? We'll come to it in a minute. So what is its impact on practice? Let's look at its impact on practice. Because we have learned how does an AI works, now see how we can apply it into our day-to-day practice. So let's take three major specialties: medicine, surgery, and gynec. I'm sure we can talk about every specialty, but because of the time, I can restrict myself to only these three specialties. The first is medicine. Now, if you really look, JAMA 2020, this is another journal, what they looked, EHR model versus AI model, live streaming vital signs, patient surgery synergy. So they will start looking at the preoperative phase, intraoperative phase, and postoperative phase. Early detection and treatment of complications, patient-specific resuscitation strategies, and personalized risk assessment and optimization. This is all helped by AI. If you really look the strengths of decision analysis, pathway to the precision or personalized medicine. So we have all been talking about pathways, protocols, but we sometimes realize that evidence-based medicine or pathways medicine doesn't work, doesn't suit to a particular patient. And then we have to change. Now AI will help us in making that particular change. It will tell us which patient this pathway won't work. And this is something which is very important to me to work as a clinician. AI saves lives in intensive care unit. This has been proved during the COVID time. And I think this was way in response to the alert. It told them how to put patients on ventilator, when to remove, not to remove, diagnosis. During COVID, this was what they saved many lives. In fact, if you really see FDA authorization, 3 days before, FDA America has authorized this Prognosis Immunoscore. FDA authorizes Prognosis software as an AI tool that can diagnose sepsis early. Many times you have patients with undiagnosed fever, undiagnosed sepsis. So these are the tools are now FDA approved. So you're going to see a new era into the medicine of diagnosis, clinical prediction, personalized medicine. Let's see impact on surgery. It's my branch, so I will talk a little more. Laparoscopic cholecystectomy is most commonly done operation with 0.3% of risk of bile duct injury. 0.3 means 3 per 1,000. It's a still large number. Now, if it's a large number of patients still do, and once injury occurs, there are going to be a lot of consequences of that injury. Now, look at this paper from Annals of Surgery. This is April 2021. They said machine learning for surgical phase recognition. What did they do? 2,254 abstracts and 35 full texts. They put the whole data into the systematic review, and they found this machine learning. They put a data input, they found out multiple phases, and they found out how people do a laparoscopic cholecystectomy, what are the variations, and they created some kind of a model. So AI will help you to predict difficulty, guide you on port placements, layering of tissues and dissections, and steps of surgery. In fact, if you really look in laparoscopic surgery, the most important aspect is what is called as a critical view of safety. That means at the time of surgery, if you are able to demonstrate the cystic duct and the artery, then I'm sure you have convincingly said that there is no likely injury to the bile duct. Now, once you said that, once you have, now somebody is operating alone in a periphery, how does he get a confidence that I have achieved CVS correctly? So what did they do? They used this computational analysis and modeling of medical activities. They give lot of data to the computer and made it possible whether pass or fail. You know, they put this data and they said, okay, many data of this particular critical view of safety. And then they say, this is what is pass, this is what is fail. Now, there is an app called Cholecystectomy AI app. This is on my mobile. Now, once you register that mobile, you can just take a picture of your screen and it will tell you whether it's pass or fail. Currently, this is the stage. It gives you clinical, surgical, and legal support. It builds the confidence of the surgeons and gives them that, okay, you have not done adequately, you have done adequately. Predicting difficulty and port placements based on the body characteristics. You know, many times when you are doing laparoscopic surgery, one port wrongly placed can make your life miserable. And I've seen many people making this mistake and then struggling throughout the surgery because one port was above or below or laterally. Now, if you understand the body predictability, body characteristics, and the pathology, AI can really tell you, based on your instrumentation, it can tell you where you should put your. So what you are wearing judgment now can be done with AI. Now, there's something called the intraoperative holography navigation. You can create a complete bile duct close by, and it will create it. This is again surgery April 2022. It will tell you completely 3D printings. You know, I don't talk about 3D printings are very commonly done today, but it will give you holography. The new Apple, which is being launched next year, is all holographic. There will be no screen. You are doing all this. You are just removing that file and doing it. It's all being done with holography. The whole idea is that we are changing towards this, and we should be aware of this. This is again, you know, where is the likely bleed point, and it will gather that kind of point. So real-time decision making in a surgical spine patient, you know, you have an input layer, and it will continuously learning by collection of data. So you can know probability of surgical success, prediction of cost and payments. All this can be easily learned in these patients. Is surgical Alexa future? I really don't know. The Mayo Clinic, few days before, I mean last 2 years before, they launched what is called as a medical Alexa. I don't know, in future, in every OT, there will be a surgical Alexa. So where I'm in difficulty, I will ask, Alexa, what should I do? Suggest me whether I should put a fifth port, increase CO2 pressure, or do a subtotal cholecystectomy. The day is not very far, I must tell you this. What is the impact of practice on gynec and obstetrics? Now, if you look, this is from Massachusetts Journal, you know, one of the top from the Boston, sperm morphology grading app, and they created this app, and they published that summary of applications of AI in IVF laboratory. From measure the sperm morphology to access oocyte quality to expand the imaging and AI options. See how much of complete change they have done. Now, the whole AI has changed the way IVF is done. What was done by judgment now is done with precision. If you really look, detecting and classifying lesions in mammography with deep learning. You know, there is now an international evaluation of AI system for breast cancer screening. All of us have seen during COVID time, the chest X-rays were done with AI. But today we have international classification, evaluation system of AI for breast cancer screening. AI and amniotic fluid calculation, artificial intelligence based automatic amniotic fluid measurement program using deep learning. You know, you can easily know if you see artificial intelligence knows how much is the fluid and when is the likely image analysis, and machine learning can be applied to fetal MRI finding to predict the need for postnatal CSF diversion. You can do it. This is JAMA Pediatrics 2020. And look at the kind of, they did 2 cohorts, you know, discovery cohort with replication cohort. And when they started using AI, 95% specificity, the specificity improved with 5 or 9%. In fact, artificial intelligence can predict preterm births in 94% accuracy, estimated fetal weight, gestation age, predicting successful vaginal delivery, and many more. And these are all recent papers from OGA Science from 2022. If you really look artificial intelligence in obstetrics, it can probably do many things which, like measuring everything. I mean, it can really tell you the prediction which a judgment is done by this. It will definitely support the judgment of a gynecologist. Let's see what is impact on medical education and training. What will it change in education and training? Now, I'm sure the first thing world came was mixed reality. All of us have heard real environment where we work. Then came augmented reality, where real world is augmented with the digital elements. We saw that in the beginning. Then came augmented virtuality. And now we are talking about the whole virtual environment today where we are learning. So they've introduced these new words like extended reality, augmented reality, mixed reality, virtual reality. And I'm sure our skill labs have now all components of all this. And many of you must have gone through this experience very easily. So what is mixed reality? It is a technique like virtual objects are integrated with the physical objects. So this is one interesting report which came, understanding of an emergent technology. This was from Horizon 2020. And they said that AI and digital technology is going to change, and they use 2 words, adaptive learning and extended reality. What does it really mean?
Placement.
The ureter is closest to the pink zone. The rectum is closest to the red zone. So our green zone in the midline is the one with the greatest safety zone with both the ureter and rectum at safe distances.
Well done. In what direction would you place the suture? Speak the color of the correct arrow.
When we're placing sutures, our area of maximal control is the entry point. So we're going to put our entry point from lateral to medial, as that's going to be closest to the ureter.
So
I'm going to
what does
choose
it
the
really
arrow
tell
from-
you? It tells you there's a girl who is trying to learn surgery on a virtual reality, and she is getting a feedback. For example, he wants to do, how do I avoid injury to the ureter? Unless she gets proficient into this, she will not be allowed to go into surgical fields. Now that's a very high level of, one of my friends' son got admitted in, got admission into Mayo Clinic as a surgery. 2 months before he joined the residency, he got a kit in his hand. He had to do video of his all basic surgical skills. He had to send it to his teacher. And there was a complete discussion on things. So by the time he went, he had become already proficient into the basic surgical skills. So the idea is today we are using remote learning, online learning, virtual reality to see that our resident skills are increased to such a level before they enter the patient any kind of a laparoscopy, because it is ethically absolutely necessary today. And if you really look at the papers, augmented reality in surgery has been validated, and it is definitely being used. If you look at the number of publications which have come, which say that this has been extremely useful in every field, with orthopedics, organ transplantation, oral maxillary surgery. Now look at this new world. Now if I tell you that the person here is on Singapore, other is in Germany, and third is in London. And you can change anything. You can talk with them, you can add muscles on this, you can do this, rotate this thoroughly, and you can teach that student anywhere. And this is something which is a mixed reality. This is Microsoft HoloLens. You know, this is one new thing which has come, Microsoft HoloLens, which is today available in India, and there are few centers have already started using it. So this is large virtual 3D images for learning, interactive and sharing, also for intraoperative surgery. It's one step ahead. Look at if I can create an image of liver like this. With the 3D reality, I can hold it, in this particular room, I can make the liver of this size, and I can hold it with my hand and rotate it. I know exactly what anatomy I'm going to deal with at the time of surgery. What advantage for person to do? Look at this kind of a liver, such a big liver with complicated tumor, I can hold my hand and rotate it. And I can know how big that liver tumor is, where it is situated, what are the vessels. In fact, one step ahead, if you really look at this, I can get what is called an intraoperative image guidance. I can cut that liver and put it next to me when I am trying to operate this particular patient. So when I am operating, actually, I can see, and then you can go this video further, you will realize that I can cut it open, and at that time I exactly know which vessels are coming from where. Now, all these mixed realities are going to make your surgery much easier because you can feed that data and get it. Augmented reality in spine surgery has come out now in a big way. Even anatomy, I'm sure now people teach with 3D, which I think many centers have these 3D anatomy centers. And I'm sure virtual intra planning. So, in fact, if you really see, all this is making you a complete use in every step of patient management. We have been using AI and HoloLens for training people into remote areas like Bhutan, Nepal, and I find it so useful that I'm somewhere there, somebody is there, then you can teach those students. If somebody is operating there, you can help those surgeons. So remote tutoring is going to be one of the future in medical education. In fact, if you see clinical use of mixed reality in laparoscopic myomectomy, you know, look at these kind of myomectomies. If I get a picture like this, exactly how many myomas there, I can really operate it much better. You know, something like delivery. You know, today, I remember when I was a student, we used to do 25 deliveries as a student. Today, a lady will not allow you if you are a medical student. It is not ethically allowed, neither it is legally allowed. So, how do I train my students with difficult labor? Now, look at these kind of things where I can put not only show labor, at the same time, I can put any kind of a difficulty, shoulder dystocia, anything, and I can put it with this mixed reality, and the students can really learn with this. And you can put HoloLens in obstetrics. In fact, if you really see...
The group is going to be understanding the same reality, so now the instructor can really focus on how to manage a complication. Nothing ever has provided that level of information. It's not a textbook, it's not a video, it's not a PowerPoint presentation that's going to give you that kind of understanding. CA Healthcare selected shoulder dystocia as the first scenario on Lucina AR because it's a rare complication of delivery, but it's one that's difficult to manage. You have a number of options, you need to think fast. Seeing the anatomy, seeing the progression of the baby in the birthing canal, and seeing where the shoulder gets stuck is going to be very helpful to understand how to fix it. Seeing them in front of your very eyes as a student is like a revelation, right? This is the future of healthcare education.
So, how does it really have a validation? What is the evidence on this? So, people have worked on this, AI tutoring versus remote expert. And you really see this is a JAMA paper from 22, what AI tutoring feedback demonstrated superior performance. In fact, if you look at papers around this, so many papers have said that it works better. In fact, if there's an improved performance with something called as a learning analytics, the new thing today is learning analytics. You know, previously I used to see a student and I used to judge him, okay, his hand is good. And I say, okay, he is better, he's a better surgeon, but this was all judgmental. Do I analyze him in more details? Yes, nowadays you would like to go more details. You know, look at this paper from surgical endoscopy. It used convolutional neural networks, and it looked at every aspect. It looks at anatomy detection. What they do, they put all the unlabeled lab videos of that student. And it gives you output, instrument detection, action recognition. In fact, it will give you a curve like this. How many times he has used bipolar, how many times he used his hook, what was the range of the movement. How is his left hand working? Which need he is to strengthen? You know, how much of analytics you can do, and then you can give focused exercises to that particular student. And then you get a feedback. The quality and precision of his training is much better. Now, this is only possible if not only by judgment, but what is called as learning analytics. And that is what is something we should all involve. And this is all with AI has been used for communication skills all over. The way I speak, the prose, pauses, it will give you all feedback when we really speak. In fact, we published a book which you can download on AI in medical education. It's a free download from this particular Pothi, that site. And I'm sure you can download this book and read about this book. The new thing came in the market was ChatGPT, and I'm sure OpenAI. In last 1.5 years it came. Everybody is a little scared. But you should really use this for your teaching learning. And in fact, today evening, I'm going to workshop is purely on how teachers should use ChatGPT and AI to make their life easy. I think it's important for us to use these tools to make our life easy rather than get scared of this life. You know, things like what is generation AI? I'm sure audio, video, images, text, videos. In fact, you can create PPTs with AI. So, way ahead with artificial intelligence. How we are going to go ahead with artificial intelligence? There are current applications of AI from everything, from embryo selection to predicting death in a hospital. I'm sure there are hundreds of applications. Analytics is most important. Today, many of you must be wearing some health wearables. Many of you will be having an Apple Watch or electronic watch. Somebody has a CGM. I can control your sugar from somewhere remote. You know, you can know where is your, I'm sure they know when is your surge. I mean, all these are so easily possible today to know from remote. And many of you are using all this with Bluetooth. And now today, if I have my sugar, I can know on my smartphone what is the trend of my sugar. It measures my sugar 208 times and without really a prick. So what is called as a metaverse and digital health? You know, today, I'm sure it was in 19th century, it was X-ray based. Then we started talking about low density city. Then we started talking about a 3D city, high density city. Then came AR, VR and AR. And now we are talking about the nodule diagnosis system. So we have completely changed the way we make a diagnosis. And this is called as a metaverse. And so if you really look the story, AI came in a big way and people had a inflated expectations somewhere in early, but it did not deliver that way. But then there was a dip. But today, there is a plateau of productivity. People have now started working. So when the deep learning came and convolutional networks came, there was some application which came. So today we are in an era of applying AI into practice. So let's look for the next 10 years and find out how we use it more effectively. So autonomous surgical robots. So what is the future? AI will probably help you for everything, preoperative planning, intraoperative guidance, surgical robots. There could be ethical and legal issues for privacy of the patient data. It will also tell you about supervised learning, 3D shaping, and all these aspects it will tell you, depth estimation, visual odometry. What I was surprised, how the curriculums change. My 11-year-old granddaughter came to me asking me, can you explain me this chapter of ethics in AI? And I must tell you, she is in a school. I mean, if all schools have changed, that they are now talking about ethics of artificial intelligence, I think you should know how the new generation is looking at it. So not only we should know advantages, we should know disadvantages and limitations, but we should also know the ethical and legal issues with AI. And if the young generation can do it from 6th standard, I think it's time that we should look at this AI more carefully. So medical profession is advancing rapidly. Some degree of expertise in focus area is must for tomorrow. Technology and data analytics are game changers, upskill networking and communication. So the last question I want to answer is, will AI replace physicians? You have a question in a mind, will I be replaced? Will the need of doctors be less with AI? And I'm sure I can see the faces talking. If AI comes, will I really be replaced? Will my need, my importance will go down? Anyway, we are finding too many medical colleges, 718 today. Too many doctors are coming out, plus AI. What will happen to the medical profession? That's what everybody is thinking. So let me ask you two questions. Will AI replace humans and clinicians? And I think, what do you all think? Yes or no? How many say yes? And how many say no? I think there are a fair number of people say, and probably that's the right answer. So AI is not a magic. Hello? Hello? Anyway. So AI is not a magic bullet that fixes every problem. Are you ready to fly with a human pilot? Or you're ready to fly with pilots, less kind of an aeroplane? Very nice, actually, movie was there, you know, Sully. I don't know how many of you see. So this fellow who had landed in Hudson. The airline industry has got the AI about 15 years before. Today they can play a plane without a pilot. But do they still play it? No. Would you be sitting in that plane where there is no pilot? Probably not. So the whole question here is the human element which comes into this. So we need today not only a radiologist, but we need a radiologist with skills of AI. So today we need a physician with skills of AI. We are not going to get replaced, but maybe our life is going to get better with AI. So whose life will get better and whose life will not get? So I think we should look at a framework of specialty. This is a very interesting slide I read about one of the papers. It says that there are some tasks which we do are repetitive. A large part of the job is same every day. And there are some tasks we do creative. In our clinical life, we go on doing it. There are some tasks which are data-based. That means there is a lot of data we use. And then some tasks where they're interaction-based, where we talk with patients, we talk and everything. So what they did, they divided specialties into these 4 categories. And they said, okay, this is what they said, will digital health technology replace physicians? Interaction-based versus data-based and repetitive versus creative. And what they came out with this, where there are repetitive tasks, it will be replaced by AI. Space for creative tools like dermatology, radiology, and ophthalmology. There are some aspects of it will be like, say, evaluating X-ray, MRI, that will be taken away by radiologists. There are some specialties which are not affected, where there is a lot of interaction and not repetition, like psychiatry, neurology, general practice, endocrinology. They are so patient-specific, like psychiatry. Very rarely it will get affected by AI. They have a limited role with auxiliary tools like geriatrics, dental, and ENT. But there are many specialties where, like surgery, sports medicine, emergency, cardiology, gynecology, they will be dependent or use these AI tools better. Wonderful framework, which will tell you that how do you do a practice and how it is affected by this AI. So we should be watchful. If I am in those specialties, I will definitely use these specialties where I will be dependent on the AI or I will bring a creative component. After a few years, radiologist will be concentrating on creative element rather than repetitive. His job will be less and he will be able to do much better creative work. So AI will never replace humans, doctors or surgeons. AI cannot replace empathy. Physicians have a non-linear working method. Complex digital technologies require competent professionals. And there will always be task algorithms and robots can never complete counseling a patient or relative for complex surgery. This becomes very difficult. Simple surgeries, yes, not difficult. So it is not technology versus humans. It is humans and human technology working together to achieve better healthcare. Artificial intelligence and humans are more potent when they cooperate and collaborate. So work with them. Don't get afraid of them. So the next question I want to ask you is, what is the surest way to get Nobel Prize? And 48 out of 92 Nobel laureates had a mentor who was a Nobel laureate. So find a good mentor. If you have a good mentor, like Arjuna had all kind of degrees, fellowships, courses he had done, but when it came to fight, he needed a mentor like Krishna. in spite of all his, whatever he wanted to do it. So you may have all technology, including AI, but you still need a good mentor like Dr. Ramnarayan. We will teach you. And I think if you have somebody as a mentor, then only you will be able to progress. So mentor is so important. So AI has come to stay. AI has the potential to improve surgical outcomes. You know, when Google came, we were all scared that will Google change my life? No, Google has helped me to do it. When internet came, PubMed came, we stopped going to libraries and writing those papers, but our life became very easy. Same thing, AI is going to make your life easy. Whether to use it positively, that is Samskruti. If you use it negatively, that is Vikruti. So we need to convert Vikruti to Samskruti. I think if you make it that Samskruti, then I'm sure we will be much further. So don't forget we are professionals and not technicians. That's the last point I want to make it. We have to understand that expertise is just our first step. Humility spurs growth. Growing by sharing. Vidya dadati vinayam, vinayat yati patradam. Patradvat dhanama prapti, dhanardhanam tatassukham. So I think Vidya vinay se deti hai, vinay se patrata, patrata se dhan, dhan se dharm, और धर्म से सुख प्राप्त होता है. We have to really remember, when we are today remembering Dr. A Krishna Rao and his contributions, I think we should always remember that Vidya Vinay se aati hai and Vinay se tumko anand aur sukh milta hai. So embrace technology with staying human. Thank you and have a great time.
Thank you, sir, for your enlightening lecture. This oration will serve a roadmap for integrating artificial intelligence more extensively into our daily practice. As per the tradition, we won't invite questions, but you may kindly note it down. Faculty who want to further interact can join for the workshop at Department of Medical Education at 2 p.m. We will now be starting the award ceremony with an invocation to God. I request the audience to remain seated. I invite Ms. Devyani, first year medical student, to deliver the invocation dance. Thank you, Ms. Devyani. We now invite our distinguished guests to the stage for the lamp lighting ceremony and to offer floral tribute to Dr. A. Krishna Rao, sir. May I kindly request Dr. Padmaraj Hegde, respected Dean, and Dr. Kirtana R. Nayak, Head of Department of Medical Education, Kasturba Medical College, Manipal, to kindly escort our dignitaries to do the honors and later to occupy the seats on the dais. The MAHE Dr. A Krishna Rao Memorial Oration Awardee, Dr. Avinash Nivritti Supe. Honorable Pro Vice Chancellor Health Science, MAHE Manipal, Dr. Sharat K. Rao, and Dr. Shubhagita, daughter of late Professor Dr. A Krishna Rao.
Thank you. I now request the dignitaries to occupy their seats. I request our beloved Dean, Dr. Padmaraj Hegde, to welcome the gathering.
Very good morning. Quote, artificial intelligence in the future is the future, comma, not only for Russia, but all the humankind. It comes with colossal opportunities, but also threats that are difficult to predict. Whoever becomes the leader in this sphere will become the ruler of the world, unquote. Putin. Artificial intelligence made a significant strides in the field of medicine, revolutionizing various aspects of healthcare delivery, diagnostic, treatment, and patient care. I think you heard from Dr. Avinash Supe. Quote, the development of full artificial intelligence could spell the end of the human race, unquote, Stephen Hawking. So today, we are in the 150th birth anniversary of our founder, late Dr. Timmy Pai, and also marks the 100th birth anniversary of Professor Krishna A. Rao. This award was started in 2021, and the first oration was delivered by Dr. Tejinder Singh. Later on, in 2022, it was Dr. Krishna Sheshadri, and last year, the oration was given by Subramanya Rangaswamy. Today, it's my proud privilege to welcome Dr. Avinash Nivritti Supe, the consultant GS surgeon, Zen Hospital, Mumbai, and the director of clinical governance, Hinduja Hospital. Warm welcome to Dr. Sharat Rao, Pro VC, Faculty of Health Sciences, MAHE Manipal. I graciously welcome the graceful lady, Dr. Shubhagita. Their family has contributed immensely. You see Dr. Girija there. Madam, you have contributed immensely and generously to start this endowment. I appreciate and I note the presence of former VC, Dr. Ram Narayan, former Dean, Dr. R.S.P. Rao. We also have Dr. Arun Maya, R.P. Pai, by present Shakuntala Pai, also Dr. Ganesh Pai. I also welcome all the associate deans, all the HODs, from Mangalore I see some consultant faculties. Ladies and gentlemen, a warm welcome to all of you. Thank you.
Thank you, sir. I request our Honorable Pro Vice Chancellor Health Science, MAHE Manipal, Dr. Sharat K. Rao, sir, to release the special video tribute to Dr. A. Krishna Rao, sir, on the auspicious occasion of his 100th birth anniversary.
In the heart of India's medical education landscape, amidst the tranquil surroundings of Manipal, a remarkable journey began. One fueled by passion, dedication, and a relentless pursuit of knowledge. And at the helm of this journey stood a visionary, Dr. A. Krishna Rao, a name synonymous with excellence, innovation, and unwavering commitment to the art and science of healing. Armed with a medical degree from Madras University in 1948, his thirst for knowledge led him to pursue a master's in physiology, solidifying his foundation in the medical sciences. In 1954, Dr. Rao, accompanied by his wife and esteemed colleague, Dr. Padma Rao, answered the call of Dr. T.M.A. Pai, the founding father of Manipal Academy of Higher Education, to join the burgeoning Kasturba Medical College, Manipal, in its infancy.
He's been a great teacher who has inspired several students, generation of students, a great mentor to many faculty members who have actually come up of age under his tutelage, and a great administrator, and above all, a thorough gentleman, a great human being. A man who is very, very simple, man who is easily approachable, a man who listens to your problems, and a man who would find solutions and suggestions.
As a teacher, Dr. Rao was unparalleled, meticulous, dedicated, and deeply invested in the success of his students. His classroom was a haven of learning, where physiology came alive through models, films, and real-life patients. Dr. Krishna Rao's scholarly pursuits were complemented by a prolific publication record with research spanning diverse topics such as blood group characteristics, medical education, and reproductive physiology.
Professor A. Krishna Rao was someone who was so much ahead of his times. Why do I say this? Almost 40 years ago, when there was no requirement of a medical education department, he started something which was available for faculty to empower themselves. He, on a very regular basis, organized teaching, learning workshops, student evaluation workshops, student learning workshops, postgraduate orientation workshops. Now, these were significant at that time because today these form the basis of many of the requirements of regulatory bodies for training faculty. It was his foresight to have these programs running on a very regular basis.
He played pivotal roles in shaping medical education policies and standards at both regional and national levels. He has trained innumerable faculty members and students through hundreds of workshops. Upon his retirement in 1985, Dr. A Krishna Rao ascended to a new realm of influence. Entrusted with the mantle of steering the development of Department of Medical Education, he embarked on a mission to nurture the minds of future educators.
We loved what he's doing, and we loved the way he mentored almost all of us. If you really see all the people who were there in that core group, every one of them, in their own way, they became academic leaders in different settings with their own individual styles. And that's what makes Professor Krishna Rao a unique mentor. A mentor who mentored people, allowed people to have their own individuality and also be able to express themselves in their own way without him expecting others to be clones of himself.
Dr. Rao's efforts rippled beyond state borders, reaching the shores of Kerala and Tamil Nadu, where his message found fertile ground. A seminal paper presented to the esteemed Indian Medical Council served as a catalyst, igniting a spark of recognition. This spark soon engulfed the Medical Council of India, inspiring a paradigm shift in their approach to medical education. Dr. Rao laid the groundwork for the establishment of departments of medical education in countless medical colleges across the nation. Dr. A Krishna Rao, fondly known as Tata or Tataji by his students, leaves behind a legacy of wisdom, kindness and profound impact.
He's a man of great qualities. He's a voracious reader. He can talk about any topic, talk to people of any age group, no discrimination of caste, creed or religion, and he has very great qualities. He's a man of integrity, simple man, very calm and goodness, and he has this thirst for knowledge and was always willing to learn something new even at the age of 90, which was admirable. He has been a doting husband, a loving father and a great grandfather and a wonderful great grandfather. His grandchildren remember him for his patience. They remember him for how they would sit around him and he would tell them stories, read books to them. They remember him when they come back from school, feeding them while we were busy in the hospital. While they ate and told them silly stories of their school, he listened patiently and in turn told them stories about what he did in college.
Though Dr. Rao may have bade farewell to this mortal realm on July 26, 2020, his teachings and spirit continue to illuminate the path for countless souls. As we remember and honor this legacy, let us carry forth his torch of knowledge and compassion, ensuring that his wisdom resonates for generations to come.
After that special video tribute, we now invite our chief guest, our Honorable Pro Vice Chancellor Health Sciences, Dr. Sharat K. Rao, to address the gathering.
Respected Oration awardee, Dr. Avinash Supe, Dr. Shubhagita, Dean Dr. Padmaraj, Dr. Kirtana, former Vice Chancellor Dr. Ram Narayan, former Dean Dr. R.S.P. Rao, Dr. Ganesh Pai, other dignitaries. It's an honor and privilege for me to be the chief guest of this function, especially being the 100th birth anniversary of Dr. A Krishna Rao. He was the Dean of KMC for 20 years. I don't think this is a record even now surpassed, not only in India and all over the world. 20 years of deanship in the infancy of the college. At that time, it was not only Kasturba Medical College. The pharmacy was under medical college. Dental was under medical college for some time. Allied health science, nursing, and what we call life science. All these were under one umbrella of Kasturba Medical College. And all these grew into individual institutions later. That shows the quality of a man who administered these departments for 20 years and the growth they had, which made them become individual departments or institutes later. As we said earlier, he was a very much loved teacher. He was very passionate about medical education. He started medical education department again, first time in India. He is a visionary because today NMC thinks that every college should have a medical education department and that should control the curriculum of medicine. He trained many teachers to excel in teaching. His vision was not only imparting knowledge, but also creating new knowledge, creating new ways to inculcate the existing knowledge. He was the epitome of dedication. I think he should have been today here to hear the lecture of Dr. Avinash. You would have loved it. Dr. Avinash, as long as AI has got still artificial along with it, it will remain below human mind. You take off artificial, then only it can be with the human being. It remains artificial intelligence. What will happen, as I heard Dr. Avinash, tomorrow we will be creating human robots. You understand the skill of a person, what he is good at, train his muscles to develop that particular skill. For example, in GI surgery, if his skill is very good in a luminal surgery or a hepatobilial surgery, so he develops his skills in a luminal surgery so that he becomes a human robot performing luminal surgeries. That is going to happen. Thank you, Dr. Kirtana, for getting Dr. Avinash here for this function. The family of Dr. A Krishna Rao, after his death, along with MAHE, started two new ventures. One, quiz for undergraduates in physiology, the department he worked, and this oration in medical education.
the department he loved. Thank you very much. Thanks for the opportunity.
Thank you, sir. Dr. A. Krishna Rao was exceptional in every role entrusted to him. Besides being an outstanding educator, he was a devoted spouse, father, and family member. May I now invite Dr. Shobhagita, daughter of late Professor Dr. A. Krishna Rao, sir, to bring forth her reflections on the occasion.
Dignitaries on the dais, Dr. Sharat K. Rao, Vice Chancellor MAHE, Dr. Padmaraj Hegde, Dean KMC Manipal, the Speaker of the Day, Dr. Avinash Supe, Kirtana, Head of the Department of Medical Education, Dr. Ram Narayan, Emeritus Professor, Department of Medical Education, Dr. R.S.P. Rao, Dr. R.P. Pai, Dr. Ganesh Pai, Mrs. Shakuntala R. Pai, Dr. Anil Bhatt, Dr. Prabhu, Mukhya Prana Prabhu, and several more people here, Dr. Anand R., Head of the Medical Education Department of Mangalore, Dr. Samir, HOD, Department of Psychiatry, and we have a senior member here, Dr. K.P. Rao is also here, I think, and other distinguished faculty and students. I think you're seeing too much of me, first virtually, and now I'm here again standing in front of you. So maybe you can close your eyes and then listen to the speech. Sorry about that. Let me at the outset thank the speaker of the day, Dr. Avinash Supe, for being here with us today. Thank you very much, sir. I will need to borrow a little of your intelligence to understand about artificial intelligence. Thank you, Kirtana and team, for taking so much trouble to put this oration together today. The first message that we received on our WhatsApp today at 4 o'clock in the morning, I don't know why Ganesh Pai wakes up so early, but anyway, he sent me the first WhatsApp message for today, and it read like this. On the 100th birth anniversary of our beloved teacher, Dr. A. Krishna Rao, we honor a remarkable soul whose dedication and wisdom shaped our lives. Through decades of selfless guidance, he ignited sparks of curiosity, instilled values, and inspired our generation. His legacy of passion for teaching and kindness continue to illuminate our path. Today we celebrate not just his milestone, but the enduring impact he has left in our hearts and minds, which is a testament to the timeless power of a great teacher. Thank you, Ganesh, for this lovely message. A few days ago, I was just reading through the letters written by my father in the year 1969. Of course, it chokes me, but then I also learned so many new points. He had gone to the UK in 1969 for a fellowship of 3 months. And that time, he must have been just in his early 40s. He visited libraries in UK, looking through books and journals, sending names of the books to my mother and asking her to tell Dayananda Pai, who was then the librarian, chief librarian of KMC, to buy those books for the library in Manipal, KMC library in Manipal. And he was also discussing medical education, 1969, way before anything was thought about here. So I think he was always a person who wanted to improve and do better. He was also at that time worrying about how my mother would manage alone in Manipal while he was away with 3 daughters. At that time, we were just shifting our house from the quarters where now I think the parking lot has come. We used to stay there earlier. There was a quarters there. And then we moved on to the new house in Anantnagar. His letter to us in 1969 is exactly 45 years to this date, April 13th, 1969. His letter reads, I am sorry we could not shift when I was there. I could have been of great help to Mummy, my mother. Anyway, Mummy is very capable and we have wonderful children who do a lot of work. And he also asks, how is Caesar? Caesar was our dog. I didn't say goodbye to him when I left, as I was upset while I was leaving. I mean, my father was always a caring, loving, calm, simple person. And he took an active part in making every event in our family very special. My mother was the laughter and energy, and my father was the steadfastness and calm. Together, they created a beautiful home that nurtured family, extended family, relatives, friends, and everyone. Languages and my father. My father was very good at speaking English. Of course, he knew his mother tongue Telugu, and he also knew Tamil. He was such a good orator in English, but his only regret was that he could not lecture in Kannada. He thought if he had learned Kannada, he could have, reached out to the public and the schools and made some change in there also. In 1962, when my father and mother were conducting the wedding of my aunt, so nobody else in the family, so they were conducting the wedding. And so my mother wanted to match the horoscopes, which we never did in our family ever again later. But at that time, they wanted to do it, and she wanted a batre. So my father heard the word batre. So he didn't know what it was. So he went at that time. There was only 2 shops in Manipal at that time. One was Manipal Bakery, another was Manipal Stores. My father thought a better option would be to go to Manipal Bakery. So he went and asked for butter. And then this great man, our Shetty of Manipal Bakery, quickly packed 1 kg of butter biscuit. That's one round yellow biscuit. Even today it is called butter for some unknown reason. And gave it to my father. And he came home with 1 kg of butter biscuits. And my mother was so amused. She laughed and laughed and laughed. And she would narrate it to us for years to come and continue laughing with the story. So that was the butter story. And and that was the laughter in our lives. The other one was, he always said, as I said, everybody knows in medical education, the 6-line word for slides. But there was also another rule for slides, about colors to be used during slides. My father was colorblind, so he could not differentiate red and green. So he would see everything as brown. So buying saris for my mother was a difficult task for him. And then luckily at that time, and even now, Manipal does not have any traffic lights, so he was safe. But he said, never use red and green in combination in a slide, because a colorblind person like me will not be able to read the slide. And that is something I think most of you students have to, if you have a green background and write in red, a colorblind person in the audience cannot read your slide. I would like to read a small poem written by Matthew C. Nine, and principal of Little Rock Indian School. He wrote it when my father was very ill, and he said he was an ardent admirer of my father. There isn't another like you. Never has there been, nor will ever be. Your stentorian voice echoed in the lecture halls of KMC for well over half a century. It was not just firm and loud, but carried great insight and depth. When you spoke, the medical fraternity listened with rapt attention, for yours was a voice of wisdom and conviction. Your body may be frail today, but your spirit is still agile. Your thinking is pure, your voice still calm and clear. It carries so much goodness, you are indeed a rare soul. Yes, he was an amalgam of humility, wisdom, kindness, and broad-mindedness, a teacher par excellence, and one of a kind human being. A very big thank you to the Department of Medical Education, Kirtana and team, Professor Ram Narayan, for arranging this oration today, and to you, Sir Dr. Avinash Supe, a very heartfelt thank you from Dr. Krishna Rao and family. Thank you very much.
Thank you, ma'am. We now request Dr. Veena Nayak, Faculty, Department of Pharmacology and Medical Education, to introduce the recipient of this year's Oration Award.
Ajnana timirandasya jnananjana shalakaya Chakshurin militam yena tasme guruve namaha. Good morning, everyone. Rendering salutations to all my teachers and gurus. It's with immense pleasure and honor that I take this opportunity to introduce a distinguished personality in the field of medicine and medical education, Dr. Avinash Nivritti Supe. It's indeed a humbling moment for me as his 2018 Famerite student at Sage GS Medical College, Mumbai, to introduce the founder director of GSMC Famer Institute. He has been a mentor, a guide to numerous Famerites all over the country and all over the world too. He's a very revered personality at KEM Mumbai. He has donned several hats, that of a clinician, an academician, a teacher of teachers, an administrator, a trekker, a photographer, and a writer. Dr. Avinash Supe completed his undergraduate, postgraduate, and super specialty training at KEM Mumbai. He has a postgraduate diploma in medical education, PGDME from University of Mumbai. He completed his FAMER in 2002, International Fellowship in Medical Education 2007, Master in Health Profession Education, University of Illinois, Chicago, USA. Dr. Avinash Supe is a highly acclaimed GI surgeon. He joined Sage GS Medical College and KM Hospital way back in 1974, and he retired as Director, Sage GS Medical College and KM Hospital, Mumbai. At present, Sir has extended his services as a consultant GI surgeon at Zen Hospital, Chembur, and Director of Clinical Governance at Hinduja Hospital. He is also Emeritus Professor of Surgical Gastroenterology and Medical Education at Sage GS Medical College, Mumbai. Throughout his illustrious career, Dr. Supe has held numerous positions, from a lecturer to the position of Director and Dean of Medical Education and major hospitals at Municipal Corporation of Greater Mumbai, where he incorporated and brought about a lot of changes in the hospitals of Mumbai, equipping them with the state-of-art facilities, be it oncology wards, transplant centers, special urology theaters, and even incorporation of technology in these hospitals. FAMER, that is Foundation for Advancement of International Medical Education and Research, has been successfully running faculty development fellowships since 2000 in the United States. This program was brought to India, and to begin with, the first such institute was commissioned at Sage GS Medical College, Mumbai in 2005 with Dr. Avinash Supe as the founder director of GSMC Famer Institute. Ever since, GSMC Famer Institute has trained a number of faculty and handheld many regional Famer Institutes across the country. Competency-based medical curriculum, CBME. A major curriculum reform was rolled out in all medical colleges in India in 2019 and backed by adequate faculty training programs for its implementation by the NMC. Dr. Avinash Supe was the chairman of the expert group of the Board of Governors, National Medical Commission. You must have all seen Sir's name on top of the list in the NMC booklets on the CBME curriculum. Dr. Supe is the chairman of the GI Surgery Board, National Board of Examinations, a visiting faculty at Department of Hospital Administration, Tata Institute of Social Sciences, Mumbai. He has also served as past president, Indian Association of Surgical Gastroenterology, Indian chapter of International Hepatopancreatobiliary Association, past secretary of Asia Pacific Hepatobiliary Association, past president of Academy of Health Profession Educations of India. Sir is a prolific author, authored 8 books, I think many more in the pipeline, 12 booklets, 300 publications, and has delivered almost around 550 presentations worldwide. The multiple honors and recognitions Sir has won attest to the worth of his work. He has been conferred the prestigious Dr. B.C. Roy Award and National Board Awards for Best Teacher, Mumbai Bhushan Award in 2020, Chembur Bhushan Award 2019, Maharashtra Bhushan in 2019, and a number of awards at national and international forums. Dr. Supe's commitment to healthcare extends beyond his professional endeavors as he actively engages in humanitarian efforts, which was evidenced during the COVID time. And also he's donated blood 126 times. And he has a role in number of philanthropic endeavors as a trustee of the Budrani Trust. In addition to his professional achievements, Dr. Supe is an avid adventurer with a passion for trekking and hiking to destinations ranging from Himalayas to Antarctica. He is the honorary member of the Photographic Society of India for his passion and contribution towards wildlife, nature, and medical photography. Please join me in welcoming Dr. Avinash Nivritti Supe, a visionary leader, invaluable asset to the medical fraternity, who will be receiving the Dr. Krishna Rao Oration Award for the year 2024. Thank you.
Thank you, ma'am. We kindly request Dr. Avinash sir to come forward and occupy the seat in the front. The felicitation process includes a citation that will be bestowed on the awardee. May I request Dr. Kirtana R. Naik, Head of Department, Department of Medical Education, to kindly recite this citation.
We, the Department of Medical Education, Kasturba Medical College, Manipal, gratefully acknowledge and appreciate your presence and involvement in rendering the MAHE Dr A Krishna Rao Memorial Oration on 10th of April 2024 in Manipal. With your passion and enthusiasm as a medical educator, faculty development programs and fellowships soar to newer heights. As an avid educator and teacher, novel ideas and innovative approaches continue to emerge from you for the benefit of teachers in health professions. Moreover, as an accomplished and gifted GI surgeon and a nationally reputed faculty in the field of GI surgery, you have contributed immensely in this domain for its spectacular advancement. May your illustrious career continue to inspire and mentor many more in the years ahead. We congratulate and wish you abundant happiness, robust health, and even more fulfilling attainments in the future. Best wishes to you, sir.
Thank you, ma'am. May I now invite the dignitaries on stage to kindly present the citation award to Dr. Avinash Supe.
Thank you, sirs and madams. And as a response to the citation, may I now invite Dr. Avinash Supe, the awardee of MAHE Dr. A Krishna Rao Memorial Oration Award 2024, to address the gathering.
Respected dignitaries on the dais and in the auditorium, all my colleagues, I'm really humbled and honored to have this award. I'm sure we get a lot of awards, but some awards are special. The special award is from the name of the person who has dedicated his life in medical education, who had a vision of developing this specialty of medical education much before anybody could thought in this country. And the way you are taking this further is something which is exemplary. I always have a great respect for this organization, the way they update themselves and the culture and the ethics. So I feel this award has more value to me, and I'm sure I'll cherish it and remember it. Thank you so much.
Thank you, sir. We request our Associate Dean and Faculty of Medical Education, Dr. Krishna Nand Prabhu, sir, to deliver the vote of thanks.
Good afternoon. It gives me immense pleasure to deliver vote of thanks on the occasion of Dr. A Krishna Rao Memorial Oration Lecture 2024. We are indebted to family members of Dr. A Krishna Rao, Dr. Girija Madam, Dr. Gauri and Dr. Shubhagita for their generous gesture. Your donation is very prized and will forever be held high regard in our memory. We really cannot thank you enough. I sincerely acknowledge the matching grant given by MAHE Trust to support this event. We would like to thank Dr. Avinash Supe for accepting our invitation and this award. I am sure your remarkable depth of understanding of the subject made the lecture an exceptionally stimulating and informative one and will have a significant impact on every person present here today. Thank you, sir. I would like to express my profound gratitude to our Pro-Vice Chancellor, Health Sciences, MAHE Manipal, Dr. Sharat K. Rao, for his inspiring address as a chief guest and wholehearted support for the program. My deep appreciation to former Vice Chancellor Dr. Ram Narayan and former Dean Dr. R.S.P. Rao for gracing the occasion. I sincerely thank our Dean Dr. Padmaraj Hegde for welcoming the gathering and his constant guidance in execution of this program. I thank Dr. Veena Naik for introducing the awardee. I am grateful to Dr. Kirtana Naik, HOD Medical Education, for giving the citation of this award. A hearty thanks to all invited guests, faculty and students for attending this oration. I thank all faculty members of medical education for their support in the conduct of this event. Support in the provision of facilities by IT department, chiffon wheels and audiovisual is very much appreciated. Thank you one and all.
Thank you, sir. With this, we have come to the end of MAHE Dr. A Krishna Rao Memorial Oration. Let's aspire to mirror and create a lasting impact through strong work ethics, selfless dedication to service, unwavering commitment following the footsteps of Professor Dr. A Krishna Rao. A gentle reminder regarding the workshop on how to use ChatGPT and AI for health professionals with our resource person, Dr. Avinash Supe, today afternoon at 2 p.m. at Medical Education Department, 2nd floor Health Sciences Building. Now we request everyone to join us for lunch that has been arranged outside the hall. Thank you.